What is wheezing? So basically, when someone describe if they have a wheezing sound, basically it's a high-pitched whistling-like sound that occur during breathing. Usually it will happen when you inhale. It happens when you take in a deep breath, and that time the wheezing sound can happen. So usually this wheezing sound can also be associated with difficulty breathing. It can also have association with very fast breathing. You can see that when someone is breathing very fast, sometimes you can observe that their muscles over the chest and over the neck is very prominent. We call it a usage of accessory muscles of respiration. So those are the features that can be associated with wheezing sound, and you have to be very careful when you have wheezing sound because it may indicate that you have a breathing issue. Wheezing can be due to multiple illnesses, especially pertaining to lung problem or heart problem. Basically what happens when someone is having wheezing is that the airway, which is the pathway connecting our nose, throat and our lungs, are narrowed, inflamed. So this is how a normal airway looks like. You can see the diameter is huge, the air can go in and out. But when someone is having wheezing sound, they are actually having inflammation of their airway, causing a lot of phlegm being developed here. So this phlegm will cause a narrowing of the airway. So this narrowed airway will cause the wheezing sound to happen. You can also see how when inflammation happens, the airway is very narrow here. You see, compared to the normal airway here, the diameter is huge, there can go in and out. But when someone is having wheezing, the airway is actually narrowed. A lot of phlegm is actually obstructing the airway. So this narrowed airway is actually causing the whistling sound of the air, or we call it wheezing. And you can see the muscles also constricted the muscles of the airway. This will further worsen the wheezing sound that someone can have due to inflamed airway and due to narrowed airway. Have multiple lung problem that can cause wheezing sound, amongst which you can have asthmatic attack. When someone is having asthmatic attack, they can have significant wheezing sound. And if someone is having lung infection, for example pneumonia or bronchopneumonia, they can also have wheezing sound as well, especially if the pneumonia is causing bronchospasm, which is sudden constriction of the airway in pneumonia patient. And sometimes tuberculosis or TB infection can also cause wheezing, especially if the TB is affecting the airway. We call it as endobronchial TB. So there is also a possibility of having wheezing if someone is infected by tuberculosis. And sometimes people who are chronic smoker with chronic obstructive pulmonary disease or COPD, they can also have wheezing sound, especially if they have the COPD exacerbation. And if someone have allergic reaction, they can also have wheezing, especially if they have difficulty breathing. I've seen a few patients who develop allergic reaction after being bitten or stung by bees. Suddenly they have difficulty breathing, they have wheezing sound. Sometimes foreign body which is dislodged or stuck in our airway, that features can also cause wheezing sound to happen. And some heart problem, for example heart failure, can also cause wheezing sound among patients. Any form of lung infection, viral infection or bacterial infection that can affect your airway, that can affect your lungs, can cause you to have wheezing. For example, commonest viral infection that can affect your airway include rhinovirus, respiratory syncytial virus, influenza virus A, influenza B, C, D, E, or para-influenza viruses, or sometimes COVID virus can also cause someone to have wheezing, because these viruses can actually cause infection and inflammation of the airway, and when your airway is inflamed, definitely you can have wheezing. Other bacteria that can also cause wheezing will include Streptococcus pneumoniae, Klebsiella pneumoniae, Moraxella catarrhalis, or other type of bacteria. Those are the common bacterial infection that can affect our lungs and our airway, hence causing someone to have wheezing problem. I've seen a few patients who have wheezing when they have some foreign object stuck in their airway. Some people, for example, when they eat, they have choking episode. So this choking episode can also trigger wheezing if the foreign body dislodged into the airway. I've seen quite a few patients with foreign body problem, for example, fish bone or chicken bone, stuck into their airway, causing them to have very bad wheezing. Some patients even have some shilling or some pin or some ball pen cap stuck into their airway, causing them to have wheezing sound. So these are the cause of wheezing sound. Apart from the inflammation infection, foreign body is actually one of the commonest cause of wheezing sound, especially among children. So be very careful when you have wheezing problem. Some wheezing can last for about few minutes, some wheezing can last for about few hours, some wheezing can last up to 2 to 4 days. It depends on the underlying cause. It depends on whether the patient is seeking the treatment fast. It depends on the patient's recovery rate. Some patient with very fast recovery rate, upon receiving treatment, the wheezing can stop within few minutes. Some people, the wheezing can only stop after a few hours, some people after a few days. So it depends on the source of the wheezing. What is the cause of the wheezing? And with the source of it, the cause of it can be treated as fast as possible, and depends on the patient's recovery rate and the response rate as well. Some patients recover faster, some patients recover slower. So it really treatment dependent, it really person dependent, it really also depends on the underlying illness as well. Well, it depends. Some form of mild wheezing can resolve by itself, but usually patients who have wheezing will need some form of treatment, whether it can be in the form of inhaler or nebulizer or steroid injection or antibiotics or oxygen. Definitely when someone is having wheezing, it means that there is something need to be done about it. So like I said, usually it depends on the severity, but majority of patients with wheezing, they will need some sort of treatment. But some patients, they can have very mild wheezing, means that when they are exposed to cold temperature, suddenly they found that they have some wheezing sound. Some patients describe it as cat sound. So when someone is having wheezing, definitely there is some inflammation going on, so you need to be treated actually, whether by inhaler or medication. If let's say it is not treated properly, it can lead to more serious problem, it can lead to more sinister damage, and sometimes it can lead to death. I've seen a recent case, a very young boy who had very bad asthmatic attack after came back from his football match. So he was wheezing away despite taking his regular, he still wheezed, and then unfortunately, he was not able to be sent to the hospital as soon as possible. So upon arrival to the hospital, his face is already blue, and he was diagnosed to have brain damage already upon arrival to the hospital, because he has undergone a very prolonged hypoxia, means that he has significant duration of low oxygen level. So a prolonged low oxygen level or prolonged hypoxia can lead to brain damage. Our brain cannot tolerate very low oxygen. If it's more than 8 minutes of very low oxygen, it can definitely lead to brain damage, and this will subsequently lead to death. So wheezing can be very serious. Please do not take it lightly. Take care of your lung health. If you notice that you have wheezing sound, quickly go and see your doctor to assess whether you need some form of treatment for your lung issue. So this is when you need to see the doctor. Only the doctor can diagnose the cause of your wheezing. So you need to undergo a thorough lung examination. The doctor will have to listen to the lungs by using a stethoscope, and then we can identify where is the actual problem. Is it due to lung problem or is it due to heart problem? So after a thorough lung examination, usually we will proceed with a chest x-ray, an imaging test, to really look at your lung tissue, your heart size, see whether the wheezing, is it due to the lung problem or due to the heart problem. And subsequently, in order to diagnose asthma, like I said, asthma can cause wheezing, you need to do a spirometry testing to assess your percentage of your lung function, whether any obstructive problem in your airway, or could this be more towards your lung tissue problem. Subsequently, you might need to do a CT scan to further diagnose your lung issue in detail, and subsequently you might need a bronchoscopy. If let's say there is a foreign body stuck in your lung airway, that foreign body can be removed by using a bronchoscopy. So those are the tests that we need to do in order to diagnose causes of your wheezing problem. So basically, in order to treat the wheezing problem, we need to identify the cause first. In the previous video, we have discussed that we need to do a thorough lung checkup. We need to do a chest x-ray, we might need to do a spirometry, a CT scan or bronchoscopy. Subsequently, once we found the underlying cause, then we can treat properly. For example, the patient that I mentioned earlier who developed wheezing after being stung by a bee. With steroid, we can relieve the bronchospasm, we can relieve the narrowing of the airway. We can give steroid injection to relieve allergic reaction. But if let's say the reason for the wheezing is actually foreign body obstruction in the airway, we need to remove that foreign body out by using bronchoscopy. And if let's say the cause is infection, for example pneumonia with bronchospasm, definitely antibiotics is the way to go to really treat the pneumonia. Hence, we will treat the wheezing sound. If it's TB, then patient have to be on anti-TB treatment, and so on and so forth. Does wheezing means lung damage? So it's not necessarily true. Yeah, usually wheezing is due to the airway problem. Yeah, but some patient, apart from airway problem, they can also have concomitant lung problem as well. Yeah, so sometimes when someone is having wheezing, it can mean that the airway is having problem, but sometimes it can also signify that the other lung tissue is also damaged as well. So this is when the thorough lung assessment is very important. You need to really be examined properly by a doctor to really identify how severe the problem, and does it involve your lungs as well, or does it just involve the airway. Yeah, so wheezing sounds can mean a lot of things. It can mean that your airway is inflamed, but it can also mean that your lung tissues are also affected if, let's say, the infection is very bad, affecting the airway and also affecting the lungs. Mild wheezing sometimes can resolve by itself, yeah? But then you have to be very careful. If, let's say, your wheezing sound is also associated with difficulty breathing, yeah? Low in oxygenation. Yeah, when you check using the pulse oximeter, you can check and then you see your oxygen is actually low, yeah, less than 95%. You know that this is something serious that you need to really be careful. Yeah? And sometimes you can see when someone is breathing very fast, yeah, you can see the breathing rate is actually very rapid. Normal breathing rate should be less than 20 breaths per minute. Yeah? But if, let's say, you see someone is breathing very fast, more than 20 breaths per minute, you know that something is not right with the lungs and with the breathing. And someone, you can see there might be some bluish discoloration of the lips, which indicate that there is some component of low oxygen level already. So when those things happens, definitely you need to quickly go to the emergency department of your hospital, or you need to call an ambulance to really help you to settle the wheezing issue.